Namaskar, welcome to everybody. Today I am Dr. Ardhendu Chatterjee, Kasapara, West Bengal. Is came to you to discuss with an important remedy, PYROGENUM. PYROGENUM, it is a remedy discovered after post-Hahnemannian era and is very important in everyday life who are practicing only homeopathy to the town, village, anywhere, because its essentiality is increasing day to day with the advancement and popularity of the homeopathic system of medicine. Now, in short, I am discussing some point that I am practicing 42 years with acute and chronic treatment, and I think that PYROGENUM is one of the essential medicine to combat the serious acute disease conditions, specifically infection, which is a part of life of now. This nosors, it is present in aliens, nosors in big form, but more specifically present in aliens small books, also in Kane's Materia Medica very perfectly. I have learned about the use of these wonderful polycrest as well as acute, most important tools of every homeopath who are depend only on homeopathy. I have no other profession. I am related with only homeopathy. This wonderful discovery, that is PYROGENUM. It is the medicine prepared from the discharge pus. So it has generally, as it is formed from pus, it has some common symptoms. Symptoms of putrefaction, symptoms of septicemia, symptoms of wasting of the disease, symptoms related with typical crisis of the life, that is extending just before the symptoms as developing just before the expiry of a patient. Now, PYROGENUM is better to describe by two ways, as it is related with some specific symptoms of Eupatorium per baptisia, sulfur, sorinum, arsenic, rustax mainly, and some other specific symptoms as tachycardia, which is the common symptoms of infective process, also bradycardia, more dangerous condition after the tachycardia when this heart is going to be collapsed. Extreme tachycardia, temperature is 100, pulse rate is above 160. Like that, it is the PYROGENUM. But in my personal opinion, it also varies that in maximum cases, bradycardia, cotrelazole acts better than PYROGENUM, and during COVID period, I got some great success on using cotrelazole routine wise. Another symptoms is bony pain or muscle pain. Bony pain is the symptoms, that is also septicemia common symptoms. Muscular pain is common symptoms. Excessive bony pain, excessive muscular pain, it is related with syphilitic miasm, and the pain relieved by external heat, external pressure, excessive external pressure, binding so tightly, like that of Caliod, Rustax, tuberculinum. Excessive heat, external heat relieves the patient, excessive binding, excessive external pressure, and soreness of the part where the patient is lying. After some times it becomes sore, So he has to change its posture. So patient became restlessness on and often within 2 or 5 minutes. Patient changes the posture of his lying condition. Patient is sweating. It is also common symptoms of septicemia. That is, the patient is infection is running, patient is sweating, but no relief developed. These symptoms particularly present with the hypersulfur mercurius and pyrogenum. Sweating with temperature. Hypersulfur is extreme chilly. Mercurius has salivation during sleep or always and profuse thirst. Pyrogenum may have less thirst. That I am coming later. And offensiveness of the every discharge. Stool offensive, breath offensive, mouth offensive, pus offensive, smell nasal breath offensive, severe offensiveness. It is the second great offensive medicine than the Sorinum. In every serious severe offensive case, I am particularly applying Sorinum. So patients are coming so nasal breath, I can't check the patient. So in such cases where I could not seated in front of patient, I am routinely use Sorinum 200 4 dose, and the patient in next time he comes with some relief of symptoms as well as vanishing of offensiveness. Then I could take the case so perfectly. And pyrogenum has these two offensiveness but restlessness, bony pain, which is not present in Sorinum. Cecal gargling. If you press the appendix region, right lower abdomen, you will get a typical sound like moving of the water within the abdomen, moving of the gas within the abdomen. It is called cecal gargling. Cecal gargling is the common symptoms of typhoid last stage, from the second stage. It is also chronic appendix patient. It is also present, so that I verified in my practice of life, practicing period. And cecal gargling also present apart from pyrogenum. It is also present in baptisia so greatly. Only on the basis of cecal gargling, two medicine we can prescribe at first. One is pyrogenum, another is baptisia. Baptisia also same the symptoms like that of offensiveness of the discharge, but baptisia body ache, but baptisia has no so much sweating, so much body ache. Baptisia has no restlessness. Baptisia always drowsy and seated on a same place. He can't move. So it is the difference between baptisia and pyrogenum. Now came to the second part of discussion, relation of the pyrogenum with other symptoms, other medicine. Suppose the Eupyterium park, Eupyterium pool. It has great bony pain. Eupyterium park has body ache, desire for warmth. Eupyterium pool, body ache, bony pain, but polyuria. Baptisia, I told you, offensiveness, cecal gargling, but has no restlessness, rather drowsy. Sulfur, like pyrogenum, in pyrogenum there are so many symptoms of sulfur is present, like that of redness of the part, burning, severe burning, relieved by cold, restlessness of the part, redness of the part. Sorinum, too offensive discharge, I discuss it. Arsenic album. It is the great relation with pyrogenum. Pyrogenum has the thirst like arsenic and burn. All and often little quantities of water pyrogen drinks. All and often small quantity of water pyrogen drinks. Arsenic has the symptoms of relief of external heat. If arsenic fail, we know there are some symptoms of medicine like that of anthraxinum. It is also the great burning, severe burning, more violent burning than arsenic, and relieved by external heat than arsenic. I applied anthraxinum in cancer cases and got marvelous relief at sin. And arsenic has the symptoms that of dysentery compound. In dysentery compound, there are symptoms of arsenic, Nux vomica, anacardium, induced vomiting, and if necessary, as a complementary of dysentery compound, complementary of anthraxinum, we can use pyrogenum. Rastrax as body ache, restlessness, and pyrogen we already discussed. It also rain exposure. So in rain exposure or lying on damp basement, pyrogenum also effective. It is a small discussion of pyrogenum. Without pyrogenum, no doctor is prescribing both acute and chronic case could persist his chamber as well. I think this discussion will help you. Good day. I will see you again. ধন্যবাদ, নমস্কার, thank you.